people used to come to therapy to try and understand whatever was going on in their life. They came to therapy to understand why they did what they did. They came to therapy to figure out ways on how to deal with the ongoing problems that they were facing, how to endure the pain or the discomfort of the challenges that they were facing, because they knew that these life challenges were part of life, normal human experience. And so they knew that they could not get rid of all their life problems. And so from time to time, they would need some help, either from a friend or professional. And there was the experience of happiness, satisfaction, fulfillment in the presence of facing challenges. There was some sort of reward that a person would experience when they build resilience after overcoming a difficulty. But lately, the goals for coming to therapy have sort of shifted, in my experience, such that people are coming to therapy not to understand themselves, not to face their challenges, but to make the problems go away. So they're coming with the goal of, how do I never ever experience this again? How do I never go through this heartbreak again? How do I never, meet a narcissist again? How do I never ever, meet someone as difficult as that? That is their goal for coming to therapy, to try and obliterate the problem, break it down to pieces so that it disappears, or completely eradicate it. And that is impossible. But yet, those are the goals that are bringing people to therapy. Like, feeling this way, feeling this much pain is not normal. It should not be normal. And I should never, ever experience it again. And by having this goal in mind, where we want to eradicate all sorts of life challenges, all sorts of problems that are part of life, we're trying to aim for perfection. We're trying to aim for flawlessness, such that we want to guarantee that we're going to live tomorrow and the day after tomorrow and all the rest of our lives never experiencing any pain. And by aiming for that, it might indicate that this person, one, may not have developed the capacity to sit with discomfort or endure pain or persevere pain. And so any amount of suffering, even if it might be something they can deal with, they're choosing not to, because in their mind they've developed this possibility that we could make the problems go away. And that's why avoidance is so prominent now, is so prevalent. We avoid problems. So we cut off our family members if they're abusive, if they're narcissistic, if they're manipulative, if they're difficult, if they make us feel frustrated, if they disappoint us all the time. Let's just cut them off. Instead of trying to find ways to deal with that, we just make the problem go away. And when we successfully achieve avoidance, like we've managed to cut these people out of our lives, the expected experience is never achieved, which is satisfaction and happiness and fulfillment. So someone who's cut off their family members continues to feel unhappy, continues to feel dissatisfied with life. And that is because they have, by cutting off that family member that probably played a role in forming their identity, in perhaps the life that they had, they're cutting off the very essence of human experience. I'm not saying that life challenges are a very good thing, but they're part of life. And when dealt with properly, as I mentioned before, when overcome effectively, then there's the resilience that we build. There's the strength that we're able to get from that. And when we eliminate all life challenges, all negative life experiences, then we're essentially also eliminating the very essence of human experience. And so that's why most people now might find therapy very boring, maybe ineffective, because their goal is, how do I never go through this heartbreak? How do I never go through this failure? How do I never go through this embarrassment? And there's no therapist in the world that can give you that. There's no one, not just a therapist, there's no one in the world that can give you that, because there's no human being that controls life challenges. It's beyond us. And so for people who are going to therapy, you want to start examining your goals for going to therapy. If it's to understand yourself, why you do the things you do, to understand how maybe your early childhood experiences are impacting the way you're relating with people today. If it's because of learning to deal with the challenges that you're facing, you know, how do you build your confidence to be able to maybe speak up, to be able to set boundaries. You want to be able to examine those, because those are what can be helped in therapy. But if you want to go to therapy for the therapist to help you make all the problems go away virtually, no one can help you with that. And so